Ladies and gentlemen, hello and welcome to this webinar. I'm Lassana Bari, specialist in communication for Pathfinder in Burkina Faso at your service. First of all, I would like to share some good practices with you so that we can have a good time together. I would ask you to mute your mic when you are not speaking and use the video only for people who speak. And the third thing is you have the choice to listen to this webinar in French or in English. You just have to go to the interpretation icon at the bottom of the screen and choose the language. And then you can raise your hand at the end of the intervention if you have questions, or you can ask questions in the chat box, which is open. So it is a pleasure for here to see that you are here to this fifth step of the series of webinar of the AmplifyPF project funded by the USAID, and it is implemented by the Pathfinder NGO in Burkina Faso, Côte d'Ivoire, Niger, and Togo. These webinars have for theme adaptation of high-impact practices in various contexts. So the first webinar of this series was about the contribution of non-government health contribution to family planning services in Burkina Faso. The second one was about the mobilization of local resources by the local support committee to the network of teaching in Niger for health, in health field. The third one was about the experience of collaboration with various business organizations to reach and target young people and inform about family planning and reproductive health in Togo. The fourth one shared the experience of the USAID on the special family planning day in order to reduce financial obstacle to the use of family planning in Côte d'Ivoire. Today, we are remaining in Côte d'Ivoire, and we are going to talk about a very specific theme. And what we mean is the experience of awareness of about sexual and reproductive health and family planning for marginalized young people who are handicapped, young and teenagers who are deaf and hard of hearing. And I would like to introduce Dr. Toure Omar, who is the specialist of maternal and infant health for nutrition and family planning for USAID, and has been in Côte d'Ivoire since September 2022. Before joining the USAID, he worked in Côte d'Ivoire for 12 years and provided technical services and program management services in the health field, especially in maternal mother and child health and family planning. He's a specialist in gynecology and obstetric since 2006. Dr. Toure is also a certified training, and he has participated actively to the preparation and implementation of training programs for health providers. So, Dr. Toure, you have the floor to be the moderator during this webinar. Thank you. Hello, everybody. Thank you, Barry. I think that the theme was presented, experience of awareness about reproductive health and family planning for young, handicapped, marginalized young people. And we want to provide equity in family planning, and we have to take into account all the people who are marginalized or feel marginalized. And I think this experience that we had in Togo could be helpful to understand how we can make progress in this field and how we can overcome obstacles. And tonight, we are going to talk with two other people. We have Dr. Hortense, who Marthe Aoui, Dr. Hortense, also, she is a pharmacist. She has more than 15 years of experience in public health and reproductive health. And she's an expert in advocacy for young people, children, and women in order to improve the health environment and integrate those people and make sure they benefit from all the available services. Dr. Hortense has been working for 6 years as a specialist for USAID at the regional level, and she's based in Togo. And the other person who will talk is Mrs. Anna Marthe Aoui. So we chose experienced people because she has 30 years of experience in the fight against HIV, and she started in her career in 1988, and she worked for various associations in Côte d'Ivoire to fight AIDS, and she did social marketing activities, and she managed a multimedia campaign for reproductive health, and she has kept working against HIV and AIDS and worked for in the field of reproductive health. Now she's specialized in helping young people within the framework of the AmplifyPF program. So you see the decades of experience of our moderators here. So now I will give the floor to Marthe, who will do the first presentation of this webinar. Hello, everybody. Hello, Dr. Touré, and thank you for giving me the floor. So, as Dr. Touré said, we are going to share with you the experience and the chance we had to work with the representative of the organization of young, deaf, and mute people. This is the agenda for today. We will first give the background of our work, talk about the Association des sourds-muets et malentendants de Côte d'Ivoire. We'll talk about the support we have provided within the framework of the project, and we'll mention activities of young champions that they implemented in favor of young people who are deaf and hard of hearing, and we will present the lessons that we have learned and give recommendations after learning from what we have done. So as we said in the introduction, in the presentation, the Amplify project is applied in 4 countries: Burkina Faso, Niger, Togo, and Côte d'Ivoire. In Côte d'Ivoire, we intervene in 5 districts: Port-Bouefreti, West-Sogo, Daloa, Bouaké, and Abobo West, where we are today. Among the goals of the project, the third one is stressing the strengthening of the capabilities of health organizations in order to improve reproductive health and increase young people's access to the serving. That's why we launched the initiative about the Young Champion in sexual and reproductive health and family planning. The Young Champion we selected were asked to organize discussions to strengthen dialogue between parents and children, organize awareness days, and meet with people to talk about reproductive health. And what we do is that we go to people's house or to their place where they work and talk to them about reproductive health. The Young Champion led also digital campaigns or social media and organize various activities during the National Day for Young People's Health, which takes place on August 12th every year. So we have 30 young champions who are divided in groups of 2 groups. with in Delaware, we have 4 groups of 8 people, in Boaké 3, and Yopogo 3, Pobwe. So it's based on the size of the district that we decided how many groups. But we also have a girl and a boy, and they know the sign language, and they work on a pro bono basis for the Muslim Association of Deaf and Hard of Hearing People in Côte d'Ivoire. The acronym is ASMCI. This association was created in 2015 based on the initiative of some people working pro bono, and they've been benefited from advice in order to create an organization with a legal structure, and it has now 350 members who are deaf, including 40% of children. The association is representative both in Abidjan and in other parts of the country. They have offices in Korobo, Touba, Bengro, and Bassa. In Abidjan, the ASMCI has about 200 members, including 38 children who go to school between 5 and 10 years old, and they are part of what we call inclusive schools. Thanks to the help of the association, we prepare them to develop literacy skills and be able to work with other children. The activities of the ASMCI are education, religious training and education, acquiring professional skills, social insertion, and also development of sign language to help people who are deaf can communicate with other people. Amplify is one of the supporters of the associations, and they gave a portable computer, a laser printer, and fans, and also enable the center, the location, to receive drinkable water. And so that was very helpful to help young people to develop their activities. So this gift was made after a visit by the regional USAID team, directed by its director, who is now the director of USAID in Côte d'Ivoire. You see in these photos, she's shown, and she's shown with young people and Amplify has been able to work with this project. What are the activities that were accomplished for young deaf and hard of hearing people? There were 7 meetings, educational meetings that were organized, and there were about 20 people took part in each meeting. There were 2 conferences based during the International Young People's Days, and the conferences were translated in sign language thanks to our young interpreters to help the deaf people to understand what was being said. We organized this dialogue, an intergenerational dialogue, and this was used to put together adults and young people to talk about reproductive health. It's never easy to talk about reproductive health, but when you are deaf or hard of hearing, it is even harder when parents do not understand the same language as the children. So we had this dialogue in order to be able to talk to both adults and young people and favor integration between adults and young people. And this dialogue included both young people and dialogues who took part.
À ce niveau de mon propos, je souhaiterais vous donner.
Now that's being said, I would like to give you a testimony that was recorded by one of the beneficiaries of this service. Because who better than that person can provide information about what he experiences on a daily level? So this is advocacy work. This is what she says, we need to be supported to be autonomous. So if if we are autonomous financially speaking, a boy cannot come and seduce us with money and get us pregnant. That's not the only testimony. There's also the daily life with regards to the experience with health. So another deaf and hard of hearing girl said that when she went to the hospital, and this is what she said. So since I didn't have an interpreter, I went to the hospital with my mom, and the doctor asked where it hurts, and my mom replied that I couldn't hear. The doctor said, "Ooh, it's going to be challenging. How am I supposed to take care of her if she can't explain her pain?" That's why when my mom says she'll try to explain my illness to the doctor, and that's how it goes in hospitals with my deaf and hard of hearing brothers and sisters. So what are the lessons learned? What worked well in what we did? What worked well is first we engage our young champions. They were available and determined. We also work with the young ambassadors that were available. We would not have been able to engage them without those young champions and interpreters in sign language. And if you want to bring awareness to people, you have to be available. And the youth and the parents were always available when we invited them to activities. And we believe this activities makes us understand that we need to encompass all the people in our health programs, regardless of what they are, so that we can talk about equity. So what is it that didn't work? True, we had our two young champions, but they're volunteers, they're not paid, and they prepared their high school degree. So how can they be available to accompany people in health centers? They don't have the time for it. So we did not have any interpreters to accompany those deaf and hard of hearing youth. So this is why we would like to suggest a few recommendations. It would be interesting that health agents be trained in sign language, and we create ads, and we would like those ads to be translated, those video ads to be translated into sign language. So of course, those programs are extended to some activities in cities, but not to the people outside of cities, and integrate RH and FP into schools of deaf and hard of hearing and other young people living with disabilities. So who did we work with? We worked with CNSSUSAH, which is the National School and University Health Program for Adolescents and Youth Health. We also work with Departmental Directorate for Youth Promotion District, the Youth Ambassador for Reproductive Health and Family Planning, and the West Africa Breakthrough Action. So those were my words of conclusion and this is how I say goodbye in sign language. And this is how I say thank you in sign language. Thank you to all of you. Thank you. Thank you, Marc, because in 30 years in public health, this has been very helpful because we were told at the end of what is we supposed to do to bring awareness. So after this, we will we'll provide you with a video, and then we will ask questions to the panelists, and then move on with the agenda. Barry, you have the floor. Marc, can you stop sharing the, or maybe Lida? Thank you. So we are now going to show you a video and to basically give an illustration and testimony and see how the USAID and AmplifyPF had an important impact on the life of youth and teenagers who are disabled with or being deaf and hard of hearing. Elena, you may proceed with the recording of the showing the video. All adolescents and youth with or without disability
AmplifyPF,
in
nous avons
AmplifyPF,
Jeune Champion.
we have a Young Champion Initiative
dans nos différents districts d'intervention
and focus on different districts of intervention.
Informel que en milieu scolaire.
It was informal.
Pour la sélection des jeunes d'Abidjan, nous avons réuni les 3 districts.
For Abidjan, we gathered all 3 districts.
Parce que elle a permis d'exposer les jeunes sourds-muets aux mêmes activités.
We were able to provide them with the same activities as the other people, as the other youth.
Comment faire pour leur parler?
How do we do if we want to communicate with them?
Pour leur parler. Donc, grâce à ces jeunes interprètes,
so thanks to those interpreters,
aux jeunes sourds-muets,
we were able to provide the deaf and hard of hearing youth with the same type of interventions.
Je me nomme Barona Minata. Je suis couturière.
I am a seamstress.
Et muette.
I am deaf and hard of hearing.
À la maison.
And at home.
C'est un peu difficile de communiquer avec les
parents. It is hard
to
communicate with my parents.
Même expliquer ça à mes parents.
When I'm sick, for example, even when I'm sick, it's hard to explain what's going on.
Souvent mes parents essayent de me parler.
And sometimes they try to speak to me.
Je ne comprends pas.
And the way they speak, I don't understand what they're saying.
Est que quand j'ai eu mes menstrues, c'était un peu difficile.
When I had my period, it was very challenging to explain to them what was happening.
Comment me tenir pendant ma période de menstruation.
And how I didn't understand how I was supposed to behave during my menses.
Parfois aussi avec les autres.
Very challenging communication.
C'est un peu difficile de m'approcher parce qu'à cause de mon handicap, un peu stigmatisé, repoussé.
I felt stigma. I felt being pushed away.
Au niveau de l'hôpital, quand j'ai un souci et je vais à l'hôpital, c'est vraiment difficile de communiquer avec
every time I had an issue, I went to the hospital. It was significantly difficult
grâce à l'association.
Communicate. And thanks to the association now,
les 2 interprètes, Mahmoud
and my interpreters, Mahmoud,
ils ont été formés sur la santé
reproductive. I was trained on health and reproductive
health. J'ai appris vraiment les différents méthodes de contraception. On a eu plus d'informations dessus parce qu'on ne connaissait pas avant. Nous avons beaucoup évolué grâce aux 2 interprètes.
And we have evolved so much
je les
thanks to those 2 interpreters.
Dans le cadre du projet Amplify, les activités que nous avons pu réaliser avec les personnes sourdes, on avait plusieurs causeries éducatives.
Was amazing.
Nous avons
Thanks to those
organisé des dialogues parents-enfants.
We organized parent-children chats and also conferences during the Youth Day, the International Youth Day.
La participation était facile et interprétée par
It was interpreted by those 2 young
Avant, elles
champions.
n'avaient aucune connaissance.
Before that, they had absolutely no knowledge whatsoever about health, about sex and sexual reproductive health.
Vous le constatez, leur handicap invisible.
Because
Et
they were
grâce au
disabled.
projet, il faut le dire, qu'on a eu la
thanks to the
chance
project,
d'interprète, même si on est jeune champion.
we were lucky enough to have those
La
2 young
formation, on a pu
champions
participer et
as
en retour,
interpreters.
on est venu transmettre la formation là, en langue des signes aux personnes sourdes.
And so we were
Et on a
able to
constaté que
receive
depuis un moment, elles ont compris beaucoup de
training
choses
and also
liées à
convey
la
it
santé sexuelle et
in
reproductive.
sign
Elles ont
language.
compris quand elles ont un bobo, il faut se rendre directement à
And that
l'hôpital
way,
et non
they
pas aller
understood that if
acheter
something
les
is
médicaments
off with their
dans la
health,
rue. Quand il y a
they
un
need
problème,
to
viens nous
go
expliquer en tant
directly to see the
qu'interprète.
doctor,
Voilà,
go
qu'est-ce
to
qu'on
the
doit faire, qu'est-ce
hospital,
qu'on
and
doit
don't go
faire.
out on the
Et
street and
on les oriente.
buy some random medication.
C'est vraiment intéressant que le personnel de santé puisse
It would be great that the health workers could be trained in sign language.
USAID pour le projet AmplifyPF.
Thank you
Et
for
Pathfinder,
USAID and AmplifyPF and also Pathfinder
Nous voulons
to have involved
agrandir
these people, this group of people.
Plusieurs personnes sourdes et les aider aussi
we
les différentes
want to help
formations que les autres ont déjà eues.
The deaf and hard of hearing and train them with the training that we already received. We would like for the state to provide sign language interpreters so that we can communicate our problems and we can have a better communication. The state really needs to get involved and hire interpreters so that they can move on with life and participate in social life. Dr. Touré, you have the floor now. Thank you for this great video. It was very moving and enabled us to understand what's going on. Now, we are going to move on to the questions to the panelists, 7 of them. I'm going to ask 4 questions, and my colleague, Tansime, will ask 3 questions. So with us today, 3 people. Mahmoud Traoré, who's a young champion and a sign language interpreter, you saw her. And also the general secretary for the Deaf and Hard of Hearing Association in Côte d'Ivoire. We saw that in the video. And finally, Dr. Roger Claude, who's deputy director for the health of youth and the whole point of the initiatives. And we will also hear from Matt, who was available, who spoke earlier. Now let's move on to the series of questions, and it is an honor to get started. Now, let's start with Mr. Traoré. First question. We heard a lot about hard of hearing. What is the difference between the training for the hard of hearing and the one who don't experience they're not disabled? I'm Naboudnou Traoré. I'm also an interpreter in sign language and young champion. So the difference between the awareness for the hard of hearing and the ones who are not disabled is the fact that we use sign language. That's the main difference. For the others, we use our voice. For the others, we use the sign language, and this is how we educate. Another question here. In sign language, when you go to a place with hard of hearing people, how do you bring them the debate to them about the education? So here's how we bring the debate. We start with examples or simulation, because it's not easy to just ask questions and get a direct answer. So we need to use example simulations with them, and this is how we communicate. And could you please give us an example of simulation that you use? So for example, on early pregnancy, we can ask the following question. What are the risks related to early pregnancies? So we can ask that question straightforward, and they don't understand. So we're going to say the following. Let's bring a 12-year-old girl who gets pregnant. Can this young girl will be able to go through, will be able to withstand a pregnancy? And why not? No, because she's too small, she can die, she can get tired, etc. So we use different scenarios. Excellent, I see. So you use a specific case, and this is how this is excellent. Now that you are the interface between the hard of hearing and the others, I'm going to ask Mr. Wakakone, who's the General Secretary of Deaf and Hard of Hearing in Côte d'Ivoire, and I believe Mahmoud will go.
In terms of collaboration, how does your association collaborate with AmplifyPF? Mahmoud, can you talk? Can you hear me? Yes. Very good.
On veut comprendre comment est-ce que la collaboration se fait.
We want to understand what type of collaboration exists between AMSCI and AmplifyPF. Yes. First, I want to introduce myself. I am Kone Abobo. I am a Secretary General.
Des sceaux musulmans de Côte d'Ivoire. En résumé, ACMC. Merci beaucoup. La collaboration entre nous et le projet, vraiment, c'est une collaboration qui est très importante pour nous.
Very important for us because it facilitates the inclusion and integration of deaf people to learn more about family planning and reproductive health. This collaboration helps those people to seize new opportunities to benefit from health services with the help of the young champion who help deaf people, and they enable them to understand more about family planning and reproductive health. Thank you. Now, can you tell us what are the changes that you have noticed since the beginning of your work with the young champions and the collaboration of the association that we mentioned? Can you talk about the changes that took place? Regarding the changes, the work of the young champion helped us increase education, especially in the field of health, reproductive health, and family planning. We must say that we have raised awareness, and we use sign language. And thanks to this project, the young champions have been able to provide the education and training that was required.
Alors, je pense qu'on vous a
I think we lost you. Wait a minute, having some problems here.
Excusez-moi. Okay. Non, allons-y. Au niveau du comportement,
regarding behaviors,
nous avons eu la bonne information en ce qui concerne.
We received useful information about contraceptive methods, because before that, very few people were aware of modern contraceptive methods, and were told that there were ways to prevent early pregnancies for young girls, and it facilitates family planning activities help people better organize their life to prevent problems in their family, because when we live in a family environment and we have to take into account what it is. Thank you. I think it is very interesting what we are hearing, this interaction between people with handicap and who can communicate with other members of the population. I think my third panelist is Dr. Oj, who is director and deputy coordinator of a school and university program. Dr. Odier, thank you for coming work with us. How do you appreciate the activities led by the young champions in reproductive health and family planning? We know that these champions have been active for a while in these two fields, but in a more general way, can you describe the impact or be specific about what they do with people living with handicap? Thank you for including me. The first thing I want to say, Dr. Toure, is that we are grateful for their work because they use their time to raise awareness. But in addition to that, when we talk about people who have a handicap, and it is an opportunity for those people. So we have been using their services more and working with them. And there are possibilities to train new people to have more sign language interpreters. That would be very helpful, because if teenagers do not understand what is being said to them, it is very difficult for them to deal with these issues. And so there will be something missing if they do not have access to these interpreters. So this collaboration is very useful in order to strengthen the health services provided to them. So this is work that I appreciate a lot. They are brave people and very generous people who help us and who use their time without compensation to help young people benefit from the existing health services, and they can help them understand what sexuality is, what reproductive health is. So we are very proud of their work, and unfortunately there are not enough of them. But this initiative is an opportunity, and what Amplify does is very helpful. And every time we have a possibility, we're happy to work with this kind of organization. We have to encourage the work being done in this field. So thank you so much for to Amplify for the work being done for themselves and for their peers. Thank you. Hello. Thank you, Dr. Oj. I think this shows the importance of the work of young champions, because you have young people talking to other young people. And if you in your position, you say that it has a major impact, we are very happy to hear that. And I think now I will talk to Marthe, who is the person who made the presentation earlier, and maybe she can tell us, talk to us about the work of this young champion and in the areas, and what are the activities to work with young people living with a handicap in the areas. What is the role, what is the part played by this young champion? Marthe, you have the floor. Thank you, Doctor. And so the RIA is like a district. It's an integrated learning network, RIA in French. And this combines all the resources, including the work of the Young Champion. So our Young Champion in various areas, in our districts, were asked to organize meetings, educational meetings, and for that they tried to invite about 20 young people to talk about reproductive health. And during these talks, they managed to talk.
C'est des sensibilisations qui ont lieu dans les lieux de vie des personnes que nous voulons rencontrer.
Who needed to know more, it could be provided. And we went close to where they live, to their house, and also where they work or study. And we also have conferences. And this happened in schools, we had meetings in school, just like before summer vacation, for instance, to make sure that the young people living with handicaps could know where to go if they needed advice or help during the summer vacation. We also had digital campaigns. The Young Champion used social media at least once a month, but there were also many activities during the International Youth Days, and many activities were organized then in 2022. They didn't only talk about reproductive health, but they also talked about everything that the agencies could give as opportunities to young people. And our sign language interpreters were present to interpret for young deaf people.
Nous avons les dialogues intergénérationnels que nous menions avec les outils, les 4 pathways qui ont été conçus par WABA. Et avec ces 4 pathways-là, on suscitait l'interaction entre les jeunes et les adultes.
Integrate better young people and adults, not only parents and children, but also young people and other adults to talk about themes associated with reproductive health. So the Young Champion worked in various districts to reach such an impact. Thank you, Marthe. And I think what all we have done is very interesting, because we know that now it is the year of the youth. And I want to now give the floor to Dr. Hortense, whom I introduced earlier, Dr. Hortense. Hello, Dr. Touré, I'm happy to be here. I hope you can hear me. Yes, we can hear you. Thank you. It's a pleasure for me to be here in this panel, and I'm very happy to hear about everything we learned that we can help people living with a handicap. So after this presentation, I would like to give the floor to our first 3 panelists, starting with Dr. Abobo Côte, who is the Secretary General of the ASSMDI, with his interpreters, Mahmoud. Mr. Secretary General, I would like to know, during your work in this association and in the implementation of this project, what are the main obstacles you have met within your association?
Oui. Merci beaucoup.
Thank you.
Les difficultés que nous rencontrons,
the problems we have encountered at the level of sexual reproductive health. First, it was a communication issue. Yes, because in various situations, it is important to have interpreters who can convey the message to deaf people so that they could have the same level of information as other young people. And at the level of hospitals, most of the health service providers and doctors who work in hospitals do not know sign language. So it is difficult for us to have people who know sign language and can help deaf patients. At the level of our association, As we said, the most important is communication, and we need interpreters to facilitate the development of our association, because if there are no interpreters, it will be very difficult for us to interact with those people we are trying to reach. Also,
notre centre est devenu très petit, comme dans la présentation.
Our center also became a little too small for all the activities that we are leading. This literacy, education, everything is happening at the same center. So if we could get a larger center, some of those challenges is that we do not receive the grants to pay for the center. And so it's basically volunteers that are helping us. So we're lacking the funds, and we would love to get some grants to continue our activities. Another challenge is how we pay our interpreters. They come and help, which is great, but they need to make a living, and they go somewhere else to make money. If we are here today, it's because our interpreters are being made available to us. So especially, on this webinar. Duly noted. So would you like to call, ask for help to our partners? We wish our partners to continue to support us in the different activities that we are engaged with. And as I said it earlier, we need a larger center. We need our own center. And if our partners could also do advocacy work to the state, so that the state could remunerate to pay the interpreters, because our interpreters are on a volunteer basis right now, and we need to help them. They need to be compensated. I would like to add something else as well. The support of partners. Yes. Oh, do you want to add something else? We need to have a center for ourselves, a headquarters for ourselves. In a world with deaf and hard of hearing people, we need to have training for them, and we need so that we are capable to meet their needs. Thank you so much. Thank you so very much, Mr. Wida. The next question is from Nabounu Traoré, who is an interpreter. What are the challenges that you're currently experiencing in sign language while trying to educate the youth? So the challenge we sometimes experience is linked to the words that we use. Sometimes the words that exist do not have the equivalent in sign language. Sign language is my mother tongue. That means both my parents are deaf and hard of hearing, so they're young. It's my mother tongue. It's what I'm used to. And then I perfected it so that I could become an interpreter. But in spite of that, there are some words that we do not know how to translate. So we resort to an image, or we need to explain what it's about. So there's some words that are just not translatable from one language to another. And it's the same for sign language. So could you give us an example Is it linked to is it due to the fact that maybe some deaf and hard of hearing learn the language, the sign language, based on experience as opposed to you? No, that's not really the case. So there's some people that do not master the sign language, for example, very well, and some that do. But overall, the sign language evolves like any other language, and sometimes those words just do not exist yet. When we have those talks, we take notes of those words, and then we submit those terms to labs in health centers, for example, implants, the IUD, all these devices, we do not have the right signs to explain what they are. And the fact that we are embedded into this project, we're in the field, it would be absolutely key to have those signs. Thank you so much. So how does it work then? So we're all volunteers. We don't always have the time to accompany those youth in the health centers. And sometimes we say Mahmoud is not available. They can come and explain what Mahmoud does, and he tells me, your daughter has this, and that. Can you go with her to the hospital? So the mother or the father know what's going on. So that makes a little bit, the communication a little bit better. But if we can, we go with them to the hospital. Understood. Thank you so much for this excellent reference work. Now I would like to, as a coordinator of this, BNS USAID can continue support the association post Amplify project, and if yes, how will that work? Yes, so the support that we're carrying is to continue the support in terms of training, in terms of knowledge, in terms of sexual and reproductive health, so that we can always accompany them when they have conferences, and also invite them to support them in the translation in sign language, and to help with our vendors. In terms of support, it would be very difficult. Now, technically speaking, in terms of knowledge, we can always support them. Now, in terms of logistics, it's going to be challenging. Now, we can ask the services to understand interpreters so that they support teenagers. Well, the challenges are quite understandable, but our job is to make them available. But there's also the confidentiality issue to make sure it's always respected, because in terms of sexuality, it is a key point, especially for teenagers and for the youth. If somebody comes and talks about the sexuality through an interpreter, it's quite daunting. So we need to train those health workers in sign so that the youth feel comfortable and they can be supported in all dignity and confidentiality when they show up and look for help. So that's my approach. Thank you so much, Dr. Oj. Thank you for all those potential solutions for future work with the association. Now, I would like to bounce back on what you just said to ask a question. How could we integrate in health services in terms of sexual and health, sexual and reproductive health? Some people, some civil servants, maybe, or health workers, those people who master sign language, because one of them, maybe one of a few of them have deaf or hard of hearing parents, for example. Thank you for this question. Yes, absolutely. We're exploring the path, but it's quite challenging. Because when we train somebody in sexual and reproductive health and adapted to youth, we talk about listening. And listening with those who don't have any disability is challenging enough. Now, if we add the extra layer of the challenge, which is sign language, we want to emphasize to have people, to work with people who are used to sign language so that they can support us. So this is more this is more what we're exploring. Those are my friends. When you ask them, sometimes as Nabutu said, there's some words that are tough to translate. So we need to look for the right words so that they're translated correctly in sign language. It's not always easy. So as you said it, we can't leave anybody behind, and we need to do with what we can. So we need to do more education on that thing. And
Docteur, ton son, vous entend pas.
Toutes mes excuses,
j'étais mute.
Je disais que... Sorry, I was on mute. Thank you so much for this excellent exchange with the panelists. Now, I'm going to continue the discussion and answer some of the questions that were in the chat box. So I will either read the question or ask the participant to ask the question again. So first question that I have here, that could be interesting. Who asked, how do you use the kits? How do you use the kits and pathways to lead intergenerational chats with this specific target? Madame Rosine, are you around to answer that question? I do not. Okay, so we are going to continue.
Monsieur Raoul Kakou. Est-ce que Monsieur Raoul
Mr. Raoul Kakou is around?
Je n'entends personne.
I do not hear Mr. Raoul Kakou.
Je ne sais pas si c'est moi qui ai le problème de connexion.
I'm having problems connection. No. Oh, can you? Hello, Mr. Raoul Kakou, you have the floor. Go ahead. You can introduce yourself and ask your question.
Allô, on vous entend.
We can hear you.
crois que la connexion est de mauvaise
qualité. I think the connection is very bad. Mr. Ralkakup, maybe you should write your question in the chat box and we can read it and we'll answer it then, okay? Because the connection is really very bad. So in order to enable the discussion to continue, I would ask you to write your question in the chat box and then we will respond. And I will give the floor to Dr. Touré for the end. But we'd like to know if young people...
association, si les autres religions ont également une association, et je pourrais compléter ce que vous travaillez également avec eux.
Oui.
La question est posée à l'ASMCI.
It's asked of ASMCI.
Allô?
OK. Docteur Odje, si vous pouvez fermer votre micro. Donc, je repose la question.
Le secrétaire va répondre.
OK, allez-y.
Excusez-moi, je le mets sur mon écran. Merci beaucoup pour la question.
Thank you very much for the question. Our association, it is true, it includes Muslim, but our goal is to accept everybody, even if they are not Muslim. Education targets everybody. Literacy should be for everybody. And the project that we have accomplished with AmplifyPF has targeted everybody regardless of their religion. So this is the way it is. We accept everybody. Thank you very much. Dr. Touré, you have the floor for the discussion. Thank you, Doctor. I think there is a question in the chat box from Mr. Anane. He asked whether this type of service used with people with hard of hearing, can it be used for people with living with other handicapped, and what can we do in this to do this? And I would like to answer for the teaching about question of sexual and reproductive health for people who are therefore hard of hearing, but are there ways to target other groups of people living with other handicap to benefit from what we do? So this is the first question, and I guess anybody in here can answer, but maybe I will ask Nancy to try to answer. If Dr. Odje can also help, it will be useful. Thank you. The secretary would like to answer. Doctor? Yes? Okay, go ahead. I will ask the question again.
Non, non, il n'a aucune connaissance. Mais seulement, moi, je vais ajouter une
chose. No, he doesn't know about any other association. But I would like to add something. When we discuss with young deaf people, there were people with other handicapped, people who are albino, for instance, and a few other people who are confronted with difficulties accessing some services. So there are other ways to approach the subject and to teach.
Dr. Odje?
Dr. Odje? Can you hear me? Yes? Can you hear me? Yes, we hear you. So, what I was saying... Mahmoud?
Oui, je ne sais pas si vous m'avez entendu ce que j'ai dit.
I don't know if you heard what I said. You talked about albinos and other people with other handicaps. Yes, they did participate in some of our awareness-raising meeting with the deaf people, and so they share their own experience. So I don't know of any other project targeting people with other kinds of handicaps, but we are trying to include them in our project. I'm through.
J'ai fini. Hein?
Okay.
Merci, Mahmoud. Merci.
Thank you, Mahmoud. Thank you, Dr. Toure. Now, can you hear? Yeah. Can you hear me? Yes. So when people live with a handicap, the experience we have had help us talk to various health service providers, especially for young people, children and teenagers with their own health issues. We try to explain to our health providers that they should not treat these people differently, but just understand what is different for them. But we should avoid any stigma. That is very important. And the provider must make sure that the person living with a handicap doesn't feel that he or she is a victim of a stigma. Because our concern, as we say, is that we're dealing with human beings who need us, and they have to feel comfortable when they come to see us and to benefit from services. But you see, there's training, but also human experience. They are two different things. And when doctors or nurses receive people with handicaps, the more they are in
charge. Mais quand ça devient pour eux nouveau, c'est difficile. Donc, c'est à nous de pouvoir le leur dire et les sensibiliser dans ce sens-là. Sinon, ce que nos amis vivant les handicaps présentent, c'est des choses que nous avons vécues. Il y a des personnes même qui n'ont pas d'handicap, mais qui pensent qu'on ne les reçoit pas bien. Donc, si cela...
The problem is people who live with a handicap don't feel well and feel they are victims of stigma. So that's what we have to avoid. We have to think about all the issues to which adolescents are confronted. And we have to understand what is preventing them from benefiting from more education in the field of sexual health. So we have to take into account these various aspects, and we have, when you understand what are the needs of the adolescent, then we can treat him or her as a whole person and address all their needs. The teenager must feel that you understand him or her. And if he feels comfortable, he or she feels comfortable, it helps a lot. That's what we're asking providers to be sensitive to the needs, not only of adolescents, but also adolescents living with handicaps. Thank you, Dr. Adier. So I think there are many people who ask a question in the chat, why is it in Abidjan only? Well, this is an experience here that is interesting. So why not provide such services in other parts of the country? And I'm sure there are other people living in other parts of the country would be interested in seeing what we do here with handicapped people. So I would suggest maybe we could make sure that the television network could be interested in what we do with people living with handicaps. Maybe they can make it known, discuss how we deal with this issue here and give advice to people working in other parts of the country. So we need more exposure in a good sense, so that more and more people know the existence of the services we provide, because we want to be sure that people who have needs, they need to know that they can reach out and find someone who can help them with their specific issues. So this is what we are trying to do, to try to increase visibility of what we are doing. And I think that we can accompany those people who can work with them. And this is a program from the WHO that targets kids in school. That could be very helpful. Can I talk now? Yes, you have the floor. Go ahead. Thank you, Dr. Touré. So after the comment of Dr. Touré, I think there are a couple of questions in the chat. I would like to share something. It is that that we have to disseminate the experience we have here and show how helpful they are, how people are grateful, and so we have to work to increase visibility. And I will answer a question for Mr. Kaku. He would like to know about the intergenerational dialect. Do their parents also have such contacts? Do they know about the actions being taken? So are parents associated with this dialogue for when they have handicapped children? And is a member of the association willing to answer? Mr. Ouedraogo Mahmoud, would you like to answer? Yeah, I would like to answer. Most cases, parents are not have the same handicap, but they live with children who have a handicap. So we have to be able to tell them how to better explain these things we discussed with their own children, and how they can educate them and give them access to more services. And in the same way, we parents explain things that sometimes even children who do not live with a handicap, it's sometimes difficult to have a discussion between parents and children, of course. But it's even harder when the child has this kind of problem, of course. So we have to educate parents too. And there is a mother who is hard of hearing, and she participated in some meeting, but she doesn't know sign language. So she could hear, but she's hard of hearing impaired, but not totally deaf. So she was hearing part of it, but it was difficult. So we have to take into account that. And Dr. Aboubakar would like to talk also. Maybe he can answer this question in the intergenerational dialogue. How is it? What happens? What if there are parents who also have a handicap? No, it's an experience I want to talk about, because we are sometimes not comfortable if parents do not understand the situation. But that's what I wanted to say. So, Alabono, I'm kind of lost now. I don't know if Dr. Aboubakar has finished speaking. Yes. Yes. I was translating in sign language. It was my answer. That's what I was doing. Thank you. And if Dr. Aboubakar has something to add, go ahead.
Non, ça va.
All set. Thank you so much. Madame Nabonou, this is what I would like to add. Most parents are not disabled. Most of them are not hard of hearing.
L'activité de dialogue parents-enfants.
So the dialogue activity between parents and children brings intimacy, basically, between the parents and the children. But there's sometimes there's some people also take part as parents, those youth. Ouattara, are you online? You are country project Côte d'Ivoire, in Côte d'Ivoire. Could you please tell us, with regards to sexual and reproductive health, what you do, what is your work with the Association for the Deaf and Hard of Hearing in Côte d'Ivoire? He is deaf. Is he around? I'm going to translate for him. I'm looking for him on the list of participants. I'm not sure he's around. If you can, maybe he can come and so that I can answer the question. I'm asking him to connect and take part in the chat. So now we are going to ask a question for Amplify. I think it is Monsieur David Jobwe regarding Amplify project. Was it implemented in different countries like Niger and Côte d'Ivoire? Why not in Benin? And when do you think you can bring? This is a question for the Amplify team. Why not in Benin?
Okay, merci.
Thank you so much. It's true. Every time the donors start a project, they are targeting a specific area. So AmplifyPF is solely dedicated to those 4 countries. There could also be a new project that can target the Benin. So, but not AmplifyPF. Thank you so much, Ma. If Dido is around, please let me know. So, Mr. Roger Zahid, could you please? Okay. What?
Est-ce que j'ai M. Saïd qui est toujours en ligne?
Is Mr. Saïd still online? Monsieur Roger Saïd?
No.
Okay, I don't think he is.
Est-ce que Dido est là?
Is Dido around?
Donc, tu as tout revérifié avec moi. Est-ce qu'on a vraiment parcouru toutes les questions?
Have we gone over all the questions?
Je pense que oui.
I believe we have.
On a parcouru les questions. La dernière grosse question, c'était celle du Bénin.
Last question was that of Benin.
Comment est-ce qu'on pouvait faire
and
pour que
how
on
to duplicate the efforts in AmplifyPF in Benin. Thank you so much. We are almost at time.
Voilà.
10 minutes.
Au nom de tous, essayer de rappeler.
In the name of all of you, I would like to remind you the main points. This is a fantastic experience that we were able to lead in sexual and health, in reproductive health, led by disabled people and by the Association of Deaf and Hard of Hearing of Muslim belief, Côte d'Ivoire, and those activities were led via Amplify Project. They were implemented through education activities in health facilities to support regular health services. We were able to listen to the different members of this association and also deputy directors of association. All of them explain the challenges in implementation and also the work of interpreters of sight language, which is challenging because it's not compensated financially speaking. It is extremely challenging too because we're relying on it's extremely challenging because they're not compensated. They have to use words that they're not necessarily familiar with, or there's no translation for. Dr. Oje is also thinking about different approaches so that the association could be supported differently. So this is basically the summary. Now, I would like to underline that 15% of the world population live with a disability. And this beautiful experience that we heard today, it would be great to see each of us how we can basically add a new stone to build this new building and continue to support people with disabilities, and how we can convey different message on the sexual and reproductive health in a different ways, and how we can have adapted tools for anyone living with disabilities. So those were the elements that I wanted to add to the conversation today. Today, people participated and brought a different perspective in Côte d'Ivoire and other countries, such as Benin, which is very interesting. This is where I'm going to stop right now. I went over all the different approaches, and now the words of conclusion from Mr. Athana. Thank you so much, Dr. Hortense. Thank you, Dr. Touré. It was the last webinar of the series around global of adaptive webinars within a specific context, which showed the impacts, the significant impacts of AmplifyPF USAID in Burkina Faso, in Côte d'Ivoire, in Niger, and in Togo. It was a pleasure to share these experiences, and we hope that we will be able to scale them up to populations. We also hope these experiences will bring new partnerships on a national level, but also with our international organization and donors. We are fully available to bring you all new information on these different approaches. So thank you sincerely to all the different teams of AmplifyPF that implemented those different approaches and participated in the organization of these webinars. Again, we want to thank you. We want to thank USAID for the great contribution in the financing of great impact in the sub-Saharan impact, which is extremely challenging. Thank you so much, all of you, and we hope to see you soon.
Merci. Au revoir.
Merci beaucoup.
Thank you.
Félicitations à vous.
Congratulations to all of you.
Félicitations.
Merci.
Congratulations.